Hello and welcome to the Cleveland Center for Eating Disorders three-part video blogging series on the diagnosis, management, and treatment of eating disorders. I'm sitting here with Dr. Lucene Wisniewski, our center's clinical director, who is going to discuss with us what causes eating disorders, the prevalence within our society, and what a provider should do should they find themselves sitting with a client who they suspect has an eating disorder. Dr. Wisniewski, what causes eating disorders?
As a field, I think we have come to a place where no one believes that there's just one thing that causes an eating disorder. In general, we believe that biology and biological risk factors load the gun for the development of an eating disorder, and then something in the environment will trigger the manifestation of the disease. I think two things are important to know. Number one is that people don't choose to have an eating disorder, and the second is, contrary to what I think popular press used to say, parents don't cause eating disorders. There's no data to suggest that either. We think it's a complex interplay of biology and environment.
What is the prevalence of eating disorders within our society?
Anorexia in particular is fairly rare, 0.1 to 1% of the population, about as common as schizophrenia, to give you a comparison. Bulimia nervosa is twice as common as that, about 1 to 3% of the population, depending on the study that you look at. And EDNOS, which is the catch-all, is obviously much more common, but because it is a wider series of symptoms. But binge eating disorder, the more specific one, is about up to 4% of the population. Again, that depends on the population that you're working with. So, for example, if you are working in an obesity management center, and obesity is not an eating disorder, about 30%, it seems, according to research, of your patients may suffer also from binge eating disorder. So I think those are important numbers to be aware of.
What should a provider do if they find themselves sitting with a patient who they suspect has an eating disorder?
I think the first piece is that you really need to be direct. You need to directly address your concerns with the patient. Don't beat around the bush. Obviously, you can be gentle, but let the patient know that based on what you're seeing, and I would be specific about the behaviors that you're seeing or the medical aspects that you're seeing, that you are concerned that this person has an eating disorder. If this is not your area of expertise, my recommendation is that you ask that patient to have an evaluation with someone who has eating disorder expertise, so that together you can decide whether or not what level of care will be most appropriate for you. And if you stay tuned in our next session, we will talk more about levels of care and empirically founded treatments.
Thank you, Dr. Wisniewski. Be sure to tune in next week for the third video in our series. In the meantime, visit us at www.eatingdisorderscleveland.org for more information, or call us at 216-765-0500 to speak with a trusted specialist.